Hello and welcome back to part 4 of this video series on staying healthy and preventing COVID-19 infection during the current pandemic. Here in brief, we are discussing the important or key items that should be implemented to minimize the risk of spreading disease COVID-19 in any country. So I'm going to list them or discuss on a priority manner. The first one is to have a rapid on-site diagnostic method where results can be obtained under 1 hour. There are several such tests now available where you get the results within 45 minutes. This RT-PCR test must be sensitive and specific so that they can be relied upon and used confidently for making the diagnosis or excluding having the disease. Secondly, markedly expand the testing facilities within and outside the hospital, including in quarantine facilities, together with the safe and humane isolation. Here I emphasize that testing facilities should be conducted outside the hospitals as well, where the risk of infection will be much less. Thirdly, community-based testing and tracking of contracts and effective reporting system. This needs to be linked with the GIS system so that it will be available to everybody in the country. Next is real-time surveillance, again GIS based, of exposed and the new patient, and the tracking of the dissemination of such information and how effective measures can be targeted to certain areas. Next is the boosting the immunity of the entire population, such as strongly encourage people to stay in sunlight for 30 minutes each day between 9:30 and noon, with a third of the body exposed to direct sunlight. This is the easiest and the cheapest way of getting sufficiency with vitamin D. Vitamin D has a predominant effect on fighting or preventing respiratory virus diseases. This has been known for 20 years and numerous clinical trials have proven this. All indications suggest that having adequate vitamin D levels, for example, more than 40 nanograms a mil, in millimoles is about 100 millimoles per liter, will significantly reduce not only the incidence of the disease but also the complication and the death rate, thereby relieving the hospital burden and relieving the need for ICU beds. But it seems that nobody is doing this simple and extremely cost-effective method. So those who cannot stay in the sunshine due to whatever the reason, taking high-dose vitamin D supplements to boost their immune system is also equally important way to prevent it. This can be difficult to achieve through nutrition, as no nutrient except for sun-exposed mushroom and fatty fish has any considerable amount of vitamin D. Next is the provision of safe and supportive environment in quarantine centers and maintain them on a humane way and make them available the most cost-effective therapies and preventative therapies such as chloroquine to people in the quarantine facilities. Number 7, regularly inform the public of the facts in a truthful manner in the real situation and proactively explain the reason for governmental action so that it will relieve the anxiety of the people and they will accept much more than blindly imposing curfews and other action without explaining to the public. It's noteworthy that telling the truth and even the appearance of truth is essential in all crisis situations, especially during public health outbreaks, so that people can take actually really an effective step by themselves. Number 8, when become available, promptly to use effective vaccines and antiviral drugs. Nevertheless, already there are the current drugs available against this viral epidemic, which can be used in ICU setup. Number 9, provide the dynamic and effective disease prevention guidance and the leadership to the public to prevent the disease and avoid panic situation at all cost. Number 10, the last one. Encourage people to engage in good personal hygiene, hand washing, and use of a face mask every time they going out of the house, avoiding crowded places and reduce self-exposure to the virus and also exposing others to the virus. So locking down affected regions or towns and movement restriction are standard procedures that are known to be effective in controlling spreading of communicable disease. But however, that alone will never going to be fully successful in flattening the peaks and controlling the disease. That is in essential part when we markedly reduce the burden on hospital system and healthcare workers and other frontline workers. They need a break. They are getting exhausted and burnt out. So people should help to control the disease so that this healthcare workers and others can get a break and also reduce the risk for themselves. In addition to the steps mentioned above, this and subsequent video messages, it is a responsibility of the public to fully cooperate with the national and local guidance. This is essential to minimize the risk for the disease for themselves and to others, and spreading in communities and to avoid secondary peak appearing in communities. Unfortunately, latter is already has begun in several countries. In my next video, I will be discussing the issues related to myths about the quarantine clock, ways to prevent the community spread of COVID-19, and what can be done to control the epidemic. Thank you till then.